When it comes to mental health services on college campuses, few decisions carry as much weight as those that directly affect students' access to care. And yet, Michigan State University, MSU, found itself at the center of a heated debate over changes to its counseling and psychiatric services, CAPS. Just when it seemed like the university was moving forward with significant changes, including layoffs and service transitions, officials hit the brakes. But here's where it gets controversial. Why did MSU pause these plans? And what does this mean for students who rely on these critical resources? Let's break it down. Over the past week, reports surfaced that MSU was considering a major shift in how psychiatric services are delivered through CAPS, which operates under University Health and Wellbeing, UHW. According to initial accounts from Megan Fuller, a student mental health ambassador, CAPS had laid off all its psychiatrists, and psychiatric care would be handed over to MSU Health Care via the MSU Psychiatric Clinic. One concerning detail: patients might have been assigned a new psychiatrist every 3 months, a move that raised eyebrows among students and staff alike. Frequent changes in providers can disrupt continuity of care, something particularly important for individuals managing ongoing mental health challenges. However, after receiving pushback and further evaluating the situation, MSU decided to temporarily halt the transition. Amber McCann, an MSU spokesperson, clarified that the decision to pause allows time for input from newly appointed leaders, including the provost and vice president of student affairs, both of whom started their roles earlier this month. This pause aims to ensure that any potential changes align with the needs of the campus community while maintaining high standards of care. Students are encouraged to continue accessing psychiatric services through UHW during this period, including subsidized visits funded by the university. Interestingly, this isn't just about psychiatric services, it extends to other areas too. For example, physical therapy services at UHW were also slated to move to MSU Health Care Physical and Occupational Therapy, located on Hagedorn Road. Unlike the psychiatric services transition, however, this change remains on track. New patients will be referred to MSU Health Care, while current patients will either complete their treatment or transfer within 60 days. Counseling services provided by CAPS will remain intact within UHW, ensuring that students still have access to vital support systems. Additionally, subsidized psychiatric visits, a lifeline for many students, will continue without interruption, even if the transition eventually moves forward. McCann noted that she wasn't aware of any specifics regarding the rumored policy of rotating psychiatrists every 3 months, leaving some questions unanswered. The controversy surrounding these proposed changes sparked a wave of activism across the MSU community. Nearly 1,500 people signed a petition calling for the reinstatement of Dr. Swapna Hingwe, the former director of CAPS, and urging the university to preserve the program's integrated care model. Petition organizers praised President Guskowitz's recommendation to involve the new provost and vice president of student affairs in shaping the future of these services, but emphasized that more action is needed. Specifically, they urged MSU to fully pause the transition, engage frontline staff in future planning, and recognize Dr. Hingwe as a trusted leader capable of guiding mental health initiatives at the university. And this is the part most people miss. While efficiency and optimization often drive administrative decisions, the human element cannot be overlooked. Students grappling with mental health issues need stability, trust, and consistent care, not uncertainty and frequent disruptions. How can universities strike a balance between operational goals and the emotional well-being of their students? It's a question worth exploring, and one that invites differing opinions. As this story continues to unfold, many are left wondering, will MSU ultimately prioritize long-term relationships between patients and providers, or will logistical considerations take precedence? Do you think the university made the right call by pausing the transition? Share your thoughts in the comments below. We'd love to hear from you.